So can we start with just telling me what your impressions were of the sessions?
Sure. Well, my first impression was that Nicole came to therapy like many of my clients, which is that she began with a crisis in her life that kind of led her to feel like it was reaching the bar of starting therapy. And then when she worked through that with you, she kind of decided to look at some of the other areas of her life, like work and relationships, and to kind of think about how she was relating to those areas of her life and see how she could improve.
Yeah, I totally agree. A lot of people start therapy because they're in crisis and are kind of maybe thinking that once the crisis passes that they might want to stop. And it always makes me happy to see that people want to continue to look at themselves and face other areas of their life, or not just face them, but maybe look to find more effective ways of relating. So I appreciate both helping people through acute periods of suffering and then also helping them explore other areas of their life.
Yeah, it's two really different types of work. And I also really appreciate it when people kind of want to stick around and dig a little bit deeper. And it seemed like from the topics that you covered that Nicole is making just really incredible use of therapy. It sounds like she's very engaged, very self-reflective, and very open to thinking about how she responds to her thoughts, to her feelings, and to different situations in her life, and kind of being flexible about changing that so that she can, feel like she's doing better in those areas.
Yeah, I agree. And I just want to comment on what it means to make good use of therapy. I think there's some forms of therapy the therapist will be much less directive and kind of encourage the client themselves to explore, primarily be doing the exploring, and maybe the therapist is just guiding. And then there's more directive forms of therapy where the therapist might be working pretty hard to help the person get better. Yeah, help the person get better. I like to see my work as like a blend in between, where the client certainly has to be willing, and it's ideal when they're looking to observe their mind and not just get relief from the content of what they're suffering from at the time, so the themes that are causing them suffering, but also they're really curious about the processes that maintain their suffering, and they can generalize those processes to other times. And so I think that does take quite a bit of work on the client's side too, where I can do my best to listen to what's occurring, pattern match it to other people that I've worked with, and try to get out in front of what might happen next. But it's really the client that is not only being vulnerable about what's happening in their mind and body, but also taking that leap of faith and choosing to change and choosing to allow the growing pains that come with that. And that takes a lot of willingness. Do you have thoughts
Mm-hmm.
about that?
Yeah, absolutely. Well, I think what jumped out at me is what you said about curiosity and how important it is to be able to cultivate curiosity, and also how challenging that is, because when you're feeling a lot of distress, when you're feeling a lot of fear or uncertainty, or if there's an area of your life that you are not feeling good about or feeling self-critical about, it can be really hard to kind of diffuse or, step back from those feelings and try to create space for compassion and curiosity. But I think that's so important, because I think that's where the flexibility comes in. I think, when we kind of just stop at the negative feelings or kind of spiral into them, it's different from just acknowledging them and validating them. They can kind of take over. But if we can get to a place where we can acknowledge our suffering, validate why we're feeling that way, but also have a little bit of wiggle room where we're inviting some curiosity about it, then we have an opportunity to relate to those feelings differently, and hopefully more effectively, or in a way that allows us to really attend to them and take care of ourselves. But I think the challenge, and I remember Nicole mentioning this, is catching it, is really kind of noticing when you're in that moment and you're having a difficult feeling, and kind of catching that that's happening so that you can use a tool that will help.
Yeah, is there anything in particular that helps you help people become more curious or respond to their own notice their self-criticism more quickly?
Yeah. Yeah, that's a great question. I think it always feels great, when we can catch it in the moment. It's always nice, you're kind of like, oh, I caught it this time, like, good for me, like I can do something about it. But I think so often it really starts with noticing afterwards, oh, I just kind of went down a rabbit hole, like I could have done this, and maybe next time I'll catch it. But I think what helps people to do that more often is to engage in some kind of deliberate practice with self-compassion. And I really see self-compassion and curiosity as very much, they go hand in hand. And so a lot of my clients, I will suggest start some kind of a regular daily, even if it's just 5 minutes, self-compassion practice or meditation practice around self-compassion, which kind of sets the tone for their day. And it kind of just puts in mind the option to approach things with self-compassion. And I think the more we engage in deliberate practice of the ways that we want to respond to ourselves, then the more accessible those ways of responding become in the harder moments.
Totally agree with you. Are there times where you get pushback about self-compassion?
Yes.
Let's talk
Yeah,
more
it's been
about
a
that.
long road to hoe with self-compassion. Um, I've been to several Kristen Neff trainings, which is where I first learned about self-compassion. And she talks a lot about how self-compassion can be sometimes confused with self-pity, with complacency. I think there's a lot of fear that self-compassion will actually keep you stuck, that it'll kind of, people sometimes say, like, let you off the hook, and then you won't really get to where you want to be going. But in actuality, self-compassion creates more openness and more flexibility to problem solve, to think about your options. Whereas I think of criticism as kind of like a dead end or like a cul-de-sac. It's like, well, I'm such an idiot because I screwed up that presentation. It's like, well, if that's true, I guess there's nowhere to go. Sometimes clients and I will kind of joke about that. It's like, well, if you think you're an idiot, it's like, oh, well, that really is like a hard stop. It's like, what are you supposed to do with that? But if you
So,
can, oh, go ahead.
yeah, so besides mindfulness-based practices, how do you teach people to have self-talk that's more compassionate?
Um, well, definitely practicing it in session, and even kind of role playing it and finding the language that fits for them. Some of the language that people hear on meditations can feel a little bit too flowery, I guess. And so they kind of have to find their own voice that feels authentic. And it's not just like, you're great, you're kind of like a general way of praising yourself. It's more about empathy and saying, like, I really understand how I'm feeling right now. And it helps people to kind of think about the language they would use with a friend, which I think you and Nicole were also talking about, and just kind of thinking about, what kind of support would I give to a friend? How would I say it? Like, what really feels authentic? And sometimes we even role play that, and I'll give examples of how I might say, use self-compassion, and then I'll also invite clients to say what they think they might say in that moment. And it's, I think, helpful because sometimes that reveals that people aren't quite sure what to say, and they have to kind of spend some time thinking about what feels genuine to them.